Just give me a brief background. Tell me about yourself.
Yeah, my name's Sarah. I've joined PharmaLink last year. I have a nursing background,
Amazing.
and I think I've been qualified for coming up to 13 years as a as a nurse in the health sector. But I have clinical trial background as well.
Okay. How did you find out about PharmaLink?
Dorothy was popping up all over my Instagram in terms of sponsored videos. So I
Mm-hmm.
was quite intrigued by what she was talking about because it seemed very relatable. So I clicked on her page and
Mm-hmm.
she was offering webinar sessions. I wasn't sure whether to join because you see a lot of them pop up on your Instagram and
Mm-hmm.
it just sounded too good to be true. And so I thought, let me just join. And yeah, here we are today, fast forward from last year. Um,
If there was someone watching your video now and they're thinking about joining the academy, but they feel doubt, what would you like to say to
I would like to say just be just transparent and honest as possible because everyone comes from different walks of life. Everyone's got their own individual stories. I wouldn't recommend you joining PharmaLink Academy if you think it's going to be a walk in the park. You have to be ready to put the effort. There's no such thing as a stupid question. Take the support that they give you. There's a lot of resources, in fact, too much resources. So it'd be quite difficult for you to join and not pass. Join the webinar because I remember when I joined the webinar, she was answering as many questions as possible. I'm sure the webinar is very different from now because the PharmaLink Academy has expanded. Whereas then when she was managing it, even by herself, she was still like answering questions. So just answer questions. If you know in your heart it's something that you can't commit to, don't do it because
them?
it's not easy. I think nothing good in life comes easy. So I'll definitely say if you really want to do it, be ready to put the work in and then you can reap the benefits. It's like driving, it's like studying. If you put the work in, you see the results. If you don't, then there's going to be a consequence. And I think that's where people often get um, misinformed. They think, oh, because it's a remote work and there's all these job opportunities, it's going to be easy. No, nothing in life has come easy. I come from a clinical background and I'm still a clinical trial background, and I still have some areas where there needs to be improvement because my role is like the opposite to what medical writing consists of. I'm sending these documents to various hospitals, but now I'm going to be the one to kind of like publicize them. So it's quite different. So you have to go in being prepared to put the work in. So that would be my advice, definitely.